From time to time, I'll get a question. A patient will come to me and say, my friend Bob had implants and a denture and he had 2 implants. Why is it, doc, that you're telling me I need 6 implants or 8 implants? And to answer this question, I just want to share with you a little bit of basic knowledge, and I hope this makes sense, and this will help you understand the differences and put you in a position of knowledge and in a position of power. So, biology versus biomechanics. When we're talking about dental implants, it's very much about foundation. It's about bioconstruction. And I like to use the analogy very simply of softwood versus hardwood. Our upper jaws are typically soft bone. It's like soft wood, like pine. Our lower jaws are typically much more dense and harder, like hardwood, like oak. So upper jaws are more like pine, lower jaws are more like oak. A carpenter knows the difference. They know that they need more reinforcement when they're working with pine. They need more reinforcement, more nails, longer nails, larger nails, all of these things to compensate for the fact that this is softer wood, this is pine. When they're working with oak or harder wood, they know it's more dense, stronger, they need fewer nails, not as long, less reinforcement, etc. And these are the particulars that I look at when I look at a patient. It's not a cookie cutter. We have to look at each person's bone, the solidness of the bone, the amount of bone, and choose the appropriate number of implants, the appropriate length, etc., to make sure that they get a strong result in the end. A carpenter knows the difference between the different types of wood, and that's as basic as it gets when we look at different solidities of bone and how many implants are needed and how strong we need to make it to compensate for the differences in jaw strength. Another good question I often get is, how long do dental implants last? I have a patient, he's a dairy farmer. He recently invested about $50,000 on his dental implants, and he asked me, is this going to last me the rest of my life? So I asked him, how much is your most expensive tractor? He said $250,000. I said, how many years do you think it will last you? He said 15 years. I was very surprised. I thought he'd get a lot more, but anyhow, 15 years. So he spends $250,000 on a top-of-the-line tractor and only expects about 15 years out of it. Yet he expects $50,000 of dental care to last him a lifetime, something that he's using his teeth and implants every day, many times a day, rain or shine, winter, summer, spring, and autumn. So the bottom line is we cannot expect a lifetime out of anything. Not God-given teeth, obviously many people lose their teeth, not man-made implants or tractors. When properly done, implants can last a very long time. We engineer it properly, we factor in all the various biomechanical factors such as the density of the bone, the amount of bone, and all of that goes into consideration to make the longest lasting dentures, the longest lasting teeth possible.